Welcome to Q&A. I'm your host, Marcia Boyles, and I'm really pleased today to introduce my two guests. I'd like to begin with Dr. Solomon Alibhai, who is the director of the Low Vision Centers in both Alexandria and Bethesda. And I'll tell you more about Dr. Alibhai in a minute. And sitting next to Dr. Alibhai is Ann Cook, who is the practice administrator of the Low Vision Group, and also the mother of a resident here, Flo Abernathy. Let me talk a little bit about the two of yours background because they're really so wonderfully impressive. Dr. Alibhai, you, in addition to getting your Doctor of Optometry, you then went on to Johns Hopkins for a fellowship.
Correct.
And you were in private practice, I think, for some years, and then you started the Low Vision Group here. And you are certainly one of the most renowned of the low vision experts here. And I understand you also consult with NIH's Institute of is it Vision or Eye?
National Eye Institute, yeah.
Eye Institute. So you're very well known to many of us, and I include myself, with low vision issues here. And you have had low vision issues, I know, since you were a small child. Off and on, it has gotten better, and when it has gotten better, you have gone back to college and nursing school. You worked in neonatal and pediatric nursing.
Correct.
For a number of years, and I know you are a strong advocate of low vision issues. You lead a support group in Vienna, low vision support group in Vienna. You have been out here to Green Spring and helped us with our low vision group, and we hope in the future you will as well. So we're just delighted to have both of you. You were out here, Dr. Alibhai, I think about 3 years ago,
Okay.
when we did a Q&A program as well then. And I know that DVD has been shown numerous times to the low vision group. So we get a lot of mileage out of your appearances here. So again, I'm just so pleased that you're willing to come out here today. Dr. Alibhai, let's begin with you. Can you tell us a little bit about what the primary causes in aging are of low vision issues?
Well, thank you, Marcia. Nice to be here. Well, the most likely reason an aging person has low vision is because of age-related macular degeneration. This is the leading cause of legal blindness in the United States.
Oh, it is?
And there are other diseases that can also affect the vision, things like glaucoma, diabetes, and there are people who are born with congenital vision problems. Cataracts used to be one of the leading causes of vision loss, but nowadays, of course, cataract surgery has been perfected. So the majority of patients I see definitely have age-related macular degeneration.
There are some treatments for that now in terms of the wet form of that.
Correct. So there are two forms of macular degeneration, dry and wet, as you said. And the dry form is the one which is the most common and the one we don't have any specific treatments for, but we encourage people to take vitamins, have a good diet made of leafy green vegetables, not to smoke, protect their eyes from the sun. And the dry typically progresses very, very slowly. The wet type is the one we actually treat because the wet type leads to hemorrhaging and bleeding in the eyes, and if not treated can very rapidly cause a lot of scar tissue and damage to the central vision. So for many years they were treating the wet with lasers, but nowadays we have this new form of treatment which is an injection inside the eye which seals all these leaking blood vessels. Still does not cure the condition, but certainly retards the progress of the condition. But only about 10% of people with macular degeneration would develop the wet type. 90% would still have the dry type.
Okay, all right. Are there particular treatments for low vision in general that have greatly improved? I mean, I'm assuming that modern digital technology has made a huge difference in the kinds of devices we can use. What are you seeing in the way of advances?
Well, the thing about low vision rehabilitation, it's really a process of learning to adapt to vision that is now chronically impaired. And for most people, that adaptation, the psychological and emotional process of adaptation, is still the most difficult. So no matter what kinds of devices and tools and gadgets and things that have come about, the first step is every individual, having been diagnosed now with a chronic vision condition for which there's no outright cure, must somehow come to terms with the fact that they may not be able to maintain their driver's license, or they may not be able to read a newspaper while they're sipping their coffee in the mornings, or they may not recognize a friend waving to them across the room. So that first step is the most important. That's the first thing Anne and I deal with when we're seeing patients in our clinic, is how have they managed to overcome the psychological and emotional aspects of vision loss. Then, of course...
How do you determine that, Dr. Alibhai? I mean, how can you sense?
How can you sense? Yeah, sometimes, it's difficult because most...
And do you ask? I mean, I don't remember anybody ever asking me, how are you dealing with
That's right.
low vision?
We just assume that nowadays people get older and deal with the ailments of aging, and surely they cope with arthritis as well as they do with their macular degeneration. But of course that's not true. There have been a number of studies done which have shown that as people age, they expect that they're going to experience aging changes, like we mentioned, arthritis, maybe hearing loss. And they kind of accept that. We kind of accept that we'll get older and we'll have some ailments. But when people develop vision problems, it's sort of unexpected, or they always felt somehow there would be some treatments for that. And so the leading cause of depression in older people can be the consequence of vision loss, more so than their other comorbidities that might be impacting them. So you're right, how do we know? Many times older people don't want to let on that they're having vision problems because they don't want their families to take away their car keys and say, well, you shouldn't be driving anymore. Or they don't want to be embarrassed and say, well, I can't read the menu, and would much rather say to somebody, so what looks good, and probably go on with that. So you're right. We often have to ask people bluntly is, how are you coping emotionally with these changes to your vision? And
one of the things that kind of surprises me about what you're saying is that macular degeneration, most folks that have it go to the retina center and for treatments. And I don't ever recall anybody at the retina center ever saying, golly, there may be some depression here, you may have some problems adjusting to this. I mean, it was just never mentioned. Anne, what has your experience been with this kind of thing?
Definitely with vision loss, you go through a period of grieving because it is loss. And I, as a younger person who's dealt with vision loss, definitely have went through a really difficult period where I was raising small children. I realized that my driving was probably not the safest at one point.
Yes.
And going through the whole stages of grief was real. I was angry, I was in denial, I probably drove a little bit longer than I should have, and then realizing that my children's lives were the most important, I had to reach out for help and say, I need to figure out who to go to get support for this. And
so you figured this out on your own?
Well,
did anybody mention it to you? That it was?
It was interesting because I have several different things wrong with my vision. I went to ophthalmologists, and it really took me advocating because I think sometimes doctors have a difficult time admitting that I can't really help you. That's a hard thing because that's what they're used to doing is fixing things, fixing problems. So I finally reached out to a couple of support organizations, Columbia Lighthouse, I think, and I asked to talk to somebody who I could relate to, and I was in my 30s, and they gave me, somebody who was 75 or 80, didn't really relate to me because I had small children. So that was difficult. I just happened to meet somebody, and I felt like this was sort of a divine intervention, that I met a woman who was around my age, younger actually, who had Stargardt's disease, which is a young person's version of macular degeneration. And she had been dealing with it for longer than I had. And she's the one who led me to find, through the Department for the Blind and Vision Impaired, somebody who could bring me some visual aids. And then she actually had hired a driver, and that led me to say, okay, I need to maybe do that. And so I did. So that was a little bit of a happenstance, but I felt like sometimes those things just happen because you need it. But
Yes.
you also do need to reach out and look for, places or people that you think can help.
Yes, absolutely. I suspect, actually, now that I think about it, Dr. Alibhai, what the retina people do is say, you really need to go see Dr. Alibhai.
That's right.
I mean, I think that was the only hint that there might be some help needed.
Yeah, no, it's true. It's sad that we sort of assume that people are coping, and oftentimes patients themselves can be under the impression that after a certain period of time their vision will return to that normal stage. So many times when patients come to see me, they're surprised and maybe for the first time having to deal with the fact that this is now a chronic problem and the vision is probably not going to get better. If anything, it may even get worse, and they're going to have to learn to live with this. So that's not a realization that automatically occurs. It's like Anne says, you go to your doctor and you're assuming if you're getting treatment, they're doing it to restore you back to where you were. And many times, like Anne said again, people can be in denial. The doctor may have said, well, we'll do this treatment to try to arrest things and stop things from getting worse. And the patient says, we'll do this treatment so we can get you better again. And they don't want to face up to the fact that this now may be a more permanent situation.
And that stability actually is probably the best possible outcome you can hope for.
Exactly, exactly.
Okay. Well, it's really interesting, and I don't recall in the support group here at Green Spring that we have had really any discussion about the fact that depression certainly would be a consequence of some of this loss, because it is really a loss. There's just no getting around it. Loss of being able to read often, or at least read easily, and driving. So it certainly does create issues for everybody that's involved in something like this. All right, has technology changed the kinds of aids that are available significantly?
I think technology has really been remarkable, and that probably is true for no matter what aspect of life we think about nowadays. Technology is really having a big impact on us. And in the past, when people had macular degeneration, we used to emphasize using magnifiers. This is one piece of technology that we've always had for years and years and years, the simple use of a magnifier. And when I think of the technology we use now, is our magnifiers are electronic too. So whereas we used to have magnifiers of a certain strength, and sometimes
Like magnifying glasses?
like a magnifying glass that you hold in your hand of a certain strength and a certain amount of light that it could do. Now we have electronic magnifiers which have various ranges of magnification built into the same magnifier, and various types of lighting and contrast abilities which we never had. So no longer is it a patient starts with one simple Sherlock Holmes-like handheld magnifier and then has to keep moving up to progressively stronger and stronger lenses, now the same one electronic digital magnifier may suffice over a certain range of vision because the same device can increase things and make them bigger. But also, when you think about things like reading, we access print in a very different way today. In the old days, when we think of reading, we think of printed material, hard copies, newspapers we hold in our hand. But increasingly now, normally sighted people use technology to read with. They have iPads, they have Kindles, and the advantage of these tablets is you can alter the size of the print. You can change the contrast of the print. You could even have the words read out to you. So since normally sighted people are using this technology as well, it's not a huge leap for a visually impaired person to use the same technology and not feel that they're somehow handicapped.
Yes.
No one really wants to be seen walking around with a magnifier where it's obvious there's something wrong with their vision. But if somebody's just holding a tablet in their hand, you may not find it any different from anybody else with normal sight holding a tablet in the hand. The other part of technology we use increasingly now are phones, what we call smartphones. And in the past, we thought of a phone as just of a way of calling somebody and having it in an emergency. But these smartphones are so smart now that they have various types of apps or applications in them which do all kinds of things. So we introduce patients to simple apps that will read the label on a product, for example, or it identifies, or it can identify the UPC symbol and tell you what the product is. These apps can even look across a room at a face and say, there's a young person who's smiling coming towards you. And the amazing thing is a lot of these apps are largely inexpensive. So we're not talking about buying technology that's expensive, where the expensive thing is the phone itself, of course. That technology is still expensive.
I had no idea. That is true. That is truly amazing. Yeah, recognizing faces is a big deal. All right, so you can help provide and install those.
Well, we introduce people to these strategies, and then we hope in their support group meetings in a place like here, where you have so many other resources, that gradually people will come to accept the use of technology and then adopt the apps and the programs and the software which we introduce them to, and learn how to use them in their day-to-day lives.
I think one of the problems that some folks have had is that if they came in here not using a computer and not really very comfortable with technology, now if they're having vision issues, it's really difficult to pick up the technology now. I think as time is going on, we're seeing people coming in at a very different level of sophistication with regard to technology. They're comfortable with computers, they're comfortable with smartphones. And so adapting to new technology, adapting to the e-readers, for example, is a fairly simple thing. It is not true, I think, with some of our older residents who came in early.
No, it's true.
And you're probably finding the same thing in your practice, aren't you?
We do, and it's always fun for me in my exam room to listen while I can hear Anne sitting outside sometimes talking to a patient, where they're marveling at how Anne is accessing her smartphone to send a text verbally, to have something read out to her. So I think this is the way we can introduce this technology more easily. If typically you come up to an older person who's not used a computer and you say, we'd like to show you how to use a computer, well then they're like, oh my gosh, they're imagining some very complicated thing. But if they see somebody who's visually impaired using something so easily that piques their curiosity, and they're more inclined to say, Anne, what is that you're doing there? Could you show us what you're doing with your phone? And this is a wonderful way, I find, that Anne often introduces the technology to a patient without them realizing now they're having to embrace this very thing that they had a phobia about.
So you sort of just put Ann out there as a
bait.
model, as bait.
He was very strategic in the way he set up his practice.
Oh, that
It
is
was-
very
He
interesting.
has always had.
Do you have imaginary conversations?
I try not to do
to-
that.
to
I
try
always
to
like scare people away. But he
I love
he also, we have several people that volunteer or work with us who are visually impaired. My counterpart who works the days I don't, Sandy, also is visually impaired, and so both of us really talk to the patients when they're not in the exam room with Dr. Alibhai, and we just kind of, add on to what he's already told them, or if it's beforehand, they'll see what we're doing. And so I do think that kind of prepares them for, wow, this is going to be a different kind of doctor's visit.
Okay.
It's not your regular doctor's appointment. It's much
exactly.
different from that.
Yes, certainly in a regular practice, you would not assume that the person who was helping you had the same issue that you were in there for.
Right,
Exactly.
exactly.
I think that's very, very clever, and
He's
very
a clever
helpful.
guy.
And very helpful. Yeah, that's excellent. We do have magnifiers in all of our lobbies here. Those large magnifiers that you were discussing for folks that need to read their mail and things of that sort. So people here do know what those large magnifiers look like. I have one personally. Couldn't live without it.
No, it's true.
They're enormously helpful. All right. Well, all this is extremely interesting. All right. What else are you seeing in the way of? Well, talk a little bit about talking books. This is a federal program. Is that correct, Anne?
Yes. The Library of Congress Talking Books program has been in existence for quite a while. I can't tell you exactly when it started.
Many
but
years.
Many years. And Fairfax County has one of their libraries at the Government Center, which they call Access Services, and they present the talking books to anyone
That's
who's
large. They have large print books too.
large print, audio books, and Braille.
Oh, and Braille, too.
So anybody who qualifies, they do have to, show by a doctor's signature that they are indeed visually impaired and need this service. So then the books are completely free. All of the material you would get, either tapes that they have a special machine that will, it's a cassette tape machine that plays books or publications. And they send out catalogs every so often telling you what new books are available. And the readers on the books today are really excellent. I mean, I know they have different retail audio books like Audible that you can download on your phones and that you pay for monthly.
Right.
And I used to think, oh, their
And some of
readers
the
are
Amazon
better.
books are also, you can
Right.
get Audible.
And those are actually actors. I mean, they hire people to be.
Yes.
Well, the talking books readers are volunteers.
Oh, they are.
But let me tell you, they have become as excellent as the ones, that you pay for. So
Good to hear.
I'm actually a member of the Friends group for Access Services because they want people who are visually impaired to be involved as well.
Oh, they do.
So it's a very well-run program through the federal government, and then Fairfax County also does a wonderful job helping giving support to their patrons. So it's great.
Dr. Alibhai, what do you see a support group doing in terms of helping patients?
Well, I think, like Anne pointed out in her own example, that she sought out others who may be experiencing what she's experiencing, not so much so she could find a better way of reading her book, but so she could find others who are having to deal with the day-to-day issues of confronting vision loss. So I think the first and most important thing about a support group is it should allow others to have a forum in which they can express how they're coping, how they're adjusting, how they're dealing with their vision loss, so they don't feel alone. Vision is unlike other disabilities where you might see somebody hobbling on a cane or having trouble lifting something, and you recognize right away that they're having a problem, and you have empathy and you want to help them. Most people with vision loss you would not recognize. I'm sitting here talking to you, Marcia, and I happen to know you're visually impaired, but neither you nor Anne look visually impaired, because our understanding of vision impairment is a blind man with a cane, which isn't the case here. So most people are visually impaired. You're not going to recognize as being visually impaired. So for a support group has the advantage that other people meet other people who look like them, who don't look visually impaired, and are surprised and saying, "Are you really? I've seen you at the dinner table all the time. I never realized that you had a vision problem. You seem to cope so well. You seem to manage so well." And the other person might say, "Yes, it may look that way, but it's like the duck on a pond. You know, the duck seems to be gliding across the pond, but underneath they're paddling madly." So this is what a lot of visually impaired people do, is on the surface they may look like they're managing, they're coping well, but underneath they're working hard to deal with it. So the first thing is a support group must allow individuals to get together and discuss how they're adjusting, how they're coping. The second thing, I think, is to have access to information about what is realistically available. People hear nowadays all kinds of things, you know, that you can have stem cells injected and you'll be cured, or you can take these special new vitamins that have come out and that's going to help you. So again, a support group is a good place where you can invite professionals to talk about, are these real? Are these things that can really be useful to save our vision? Or a lot of this is just snake oil, perhaps, that unfortunately gets propagated out there in the media, and we think it must be for real. And then the other thing is to find out about all the resources. Thank God we live in America. We have access. You mentioned talking books, but we have to remember that in this country, because of the Americans with Disabilities Act, technically every public service has to be accessible to people with disabilities, which includes vision. That means your bank will provide you with large print checks with bold lines, or your utility company will give you a special statement which is bigger and bolder that can be read by somebody who's visually impaired, and so on and so forth. So all of these resources that we have in our community, again, may not be apparent to most people, or they may not think that just because they have a vision impairment, they're eligible for metro access, for example, the substitution for public transportation, people with disabilities. But you can be visually impaired and eligible for metro access too. So these kinds of services that we have access to, people won't necessarily know about until they come to a support group meeting. And then finally, like you said, you have the option of discussing adaptive strategies. How have you been coping? What is that magnifier you're using? Or what are these machines that we have here in Green Spring that look very intimidating? And it's nice to have a support group where people can introduce these things to others who may be newly diagnosed or maybe new to Green Spring about, look, fortunately we live in an environment where there is help available and there are things you can take advantage of and make good use of. So I think having a support group is very, very valuable. And thank God that here at Green Spring you actually have a very active group led by people like yourself, and you keep yourselves well informed through this TV station, and the people you invite who come and speak here, who are interested in informing your residents about resources and services and medical treatments and so on and so forth. And I think it's very valuable that support groups get to meet other support groups. One of the ones that Anne was mentioning was one that Sandy runs, which is at the Reston Public Library. And sometimes it's interesting for one support group to go and visit another support group and find out what they're doing, what they're learning.
Think so.
You know?
Yes.
So in this way, we continue to help ourselves. So it's I think, a very useful and valuable resource.
Well, one of the things that has happened here is that we have a hearing loss support group and a Parkinson's support group and a few others, but they all are beginning to coordinate their efforts together and work to support each other too. So
Indeed.
I think there's beginning to be reciprocity between the support groups, which is a really fine thing.
Exactly.
I mean, we all have commonalities, and I think that's becoming very much apparent. Well, I think we're down now to the last couple of minutes here. What could you say about the future in terms of low vision? Do you see more cures, more devices? What would be your take on this?
Well, I think the most important thing is that everyone should always remain hopeful that there are new things on the horizon. And it's not just medical breakthroughs, which we absolutely anticipate, and we look forward to some wonderful medical breakthroughs. I don't know when we'll ever replace the entire human eyeball and restore vision back to normal. That may occur, but there are things that are occurring even on a small level, whether we're treating macular degeneration with new ways to slow it down even better, whether we're finding better ways to anticipate it so people know they have it earlier rather than in its later stages. By intervening earlier, we're preventing it from becoming more advanced and developing more difficulties for patients. So all of those things are always on the horizon. I think people, especially in a place like this, shouldn't think that because these are age-related issues that somehow science and the medical community doesn't feel it's an important issue. On the contrary, I think our population is aging. And we have more people over the age of 65 now than we ever had before, and that's just going to double. And we have more people even living in 85 and above categories. And individuals still have good enough health, good enough mental faculties, and they want to lead a productive, good quality of life. And so society is definitely gearing itself towards that. Certainly the medical community is gearing itself towards that. So I think there's going to be this paradigm shift, if you like, where you're going to see a greater emphasis on chronic conditions, ways to ameliorate them, ways to cope with them. And like you said, it's not just that people with vision impairment are forgiven from having other physical ailments. There's going to be other things too. So there's greater interaction and collaboration between specialties, saying you're dealing with somebody with vision loss, but they also have Parkinson's, and maybe the Parkinson's is contributing towards it as well. And how do we combine both strategies? And as far as visual aids and devices go, I think, as you said right at the outset today, because of technology, I can definitely anticipate technology will take over so many things. We will all be in cars that drive themselves, so it won't matter if you have to give up your driver's license. You won't be giving up your independence because you'll get into a car and say, well, drive me to the grocery store, you know? So we can look forward to all of those things. So it's not all doom and gloom, and we should certainly be very positive and hopeful that in the future we'll have better options, better strategies available, certainly.
Well, I think with that very positive note, I was hoping you would have some positive things to say, and you absolutely did. And it was lovely having you here. Your contributions have all along been terrific. And Dr. Alibhai, as always, we're just delighted having you here today, and you're going from here now to the low vision group to speak to them. So many thanks to you both for coming. I think this has been very helpful.
Thank you.
It was a pleasure.
Thank you. Thanks for joining us today. We'll see you soon.